Hello, we've been sent a case here to evaluate the lower left-hand side. I believe there was an error during transmission as the implant itself was not transmitted. Typically, we will not do any type of, there's nothing to do a critique of, but in this case, I thought I would go ahead and just review everything by going ahead and doing a plan. We see this patient here. Obviously, we can see that we're missing teeth on the lower left-hand side. Looks like we're missing tooth number 18 and 19. We have a good case for for an OptiGuide. The first thing I'll check is we have good CEREC data, well integrated CEREC data. We have a crown plan for at least site number 19. So we have everything that we need to plan a single implant. Now, one of the nice things about having good CEREC data, I like to go ahead and check out the quality of the CEREC data. So we'll go ahead and take a closer look here. And what I like to do, and one of the things that we talk about in our courses, is fine-tuning our CEREC design. So in looking at this one, the one area that I would give us a critique on in the CEREC design would be our gingival design. Would probably be more along this line right here. Here we can see that it's been drawn a little bit long. Doesn't matter that much, but not exactly. But definitely, I like to keep an eye on these things. And then we can see here our central grooves are in great alignment. So right here, everything looks very good. And then we can also see that our buccal and lingual contours are very nice. So overall, this is a very good design. And actually, if we take a look at the lingual here, we can see that that one is designed very well. My only critique maybe is that the tooth is wider, and one of the things that I like to do is just measure the width of the contralateral tooth. So in this case, I would probably measure the width of number 30 and try to make 19 the same width. We would go to the diagnosis tab, and we can't do it here. We'll have to go to the axial view. We go to the diagnosis tab, and here we can measure the width of that tooth at 10 millimeters, 10.17 millimeters, and we can measure the width of this tooth at 8 millimeters, so we can see that roughly in the right spatial, everything looks pretty good there. Actually, we can see that that line is going to be more than 8 millimeters. It'll probably be right around 10 or so. So there we go. So we can see that that is actually pretty accurate. So everything looks good. One of the nice things also with having the CEREC data in there is we can drop the implant in quite nicely. Instead of having to go here to the implant and clicking implant, selecting the tooth and all of that, we can just go to the CAD/CAM tab, click the implant underneath the restoration, and the software will automatically mark it, and you just tell it which implant, where you're placing it, and then click OK, and it'll automatically place it directly under that tooth there. So now from here we can take a closer look and get our plan in. Here we can see our mesiodistal spacing is okay, buccal lingual spacing is okay, bone level at this point looks very nice. Our main issue here is going to be occlusal table and occlusal plane. Vital structures, we've got plenty of room. So in fact, I like to, even though I may not use this implant, I like to go ahead and at least plan for how long of an implant can I use. And so in this situation, we could safely use a 13 millimeter implant. Probably 11 and a half would be great. A 10 would be more than fine as well. I just like to know which implants are possible. Our occlusal table here, we can see our implant is a little bit to the buccal. So and in the cross-section view, we can see that our implant is not in the dead center of the tooth. So we'll go ahead and just center our tooth, center our implant to the long axis central groove. And then what we can see is now we're centered on the long axis. Now we take a look at our occlusal table, and we see buccal lingually that we're well centered, but mesiodistally we're not centered. Now when we're not centered mesiodistally, our choices are bodily movement or translation. In this particular case, since our occlusal plane happens to be off, we can see right there, since we have the occlusal plane incorrect, I know that a bodily movement won't correct that. So what I like to do in this situation is do a rotational movement, and at the same time that we're rotating the tooth, we can go ahead and also fix a couple of different things at the same time. So here we can see that we can get our occlusal plane a little bit better, we can get our implant a little bit better centered, and everything looks better there now. The other thing, we do a sleeve position. Go ahead and choose our sleeve and lock it in place. And then I also often use the sleeve to help make sure that I have my implant planned to properly support our restoration. And there we go. Take a look down the line. Everything looks very good. So now we have a great plan here. Everything's ready to go, and we're ready to simply order our surgical guide. Go to the surgery tab, order surgical guide, and walk through the process. Thank you for submitting the plan. I apologize that somehow in the upload process the implant plan itself didn't come through, but hopefully this was a good exercise. Thank you.